Now we're getting into some wound packing, and these are the junctional areas, right?
Yeah, so the junctional areas, you can do wound packing on limbs, but the tourniquet controls the bleeding there. We're talking about, when you get down into the extremities and you're doing wound packing, you're doing that just to fill the cavity, get it covered, and provide another level of bleeding control. When you're talking up here in the junctional areas, either the groin or the neck or the axilla, pressure is what's going to stop that bleeding. So in this particular one, we don't have the mannequin on right now, but normally the blood would be pooling up, and I'm going to use one of our Olaes Hemcon dressings. So it's our regular Olaes dressing with the Hemcon in it already. So all we're going to do is we go in, find the source of the bleeding, apply direct pressure, and make sure we got the bleeding to stop, and then we're going to continue to fill that wound cavity with using good technique, finger over finger, maintaining pressure on that wound the entire time. We're going to get that wound packed, and stopping occasionally to make sure and confirm that we actually have bleeding stopped. Once you have the bleeding stopped on this injury, you can relax for a minute. If there's no other major stuff going on, we can relax for a second, take a deep breath, and then finish packing the wound.
Now, what's the purpose of the little twist?
Yeah, so all I'm doing is that allows me to actually wrap the hemostatic around my finger and apply pressure with more hemostatic on top of that. So there's a million ways to pack wounds. That's just one that I particularly like. The last video we're in, we showed you where I had the pressure cup over my fingers, and I was using that so I didn't have to set my dressing down, and now it's kind of a one-handed operation. So it's just the key point there is just to make sure that you maintain pressure on the wound to keep that bleeding from stopping. All the hemostatics, these hemostatics, 3 minutes of pressure is what you've got to hold. Some other hemostatics only have one minute of hold time, but you can see what I'm doing is I'm maintaining pressure the entire time. I'm not letting off and putting back on, and that's one of the key failure points when you're talking about packing wounds. But that's how you deal with areas that are not amenable to tourniquets. Because I can't put tourniquets around the waist, shouldn't really put tourniquets around the neck, that's frowned upon. But so we're doing wound packing in these areas. And from here, we just have to maintain pressure, and that's it. Although it is a hemostatic, and yes, it has assisted forming a clot, we have to maintain pressure, right? So we're gonna put our dressing on, and we're gonna wrap that up, and get our patient moving. So when we're talking about hemorrhage in areas that are not amenable to tourniquets, wound packing is the way we're going.
I see a lot of people talk about tourniquets. They carry a tourniquet. That's their only medical equipment, which is good. I mean, that helps a lot if you get hurt on your arms and legs. But if you get a wound anywhere else on your body, you're kind of screwed. So you need to know wound packing. That's the next most important part about bleeding control is wound packing.
And so that's one when we talked about, when you asked what the minimum force is, tourniquet, yes, but having a hemostatic dressing and a bandage is pretty important as well.
Yeah.
Because not only, you might stop the bleeding with your tourniquet, but you still will have a wound somewhere else that you've got to deal with. So absolutely.